From my side, I would say the government should take procurement of ARVs, even if they have partners, that the partners could do other things. But the issues of procurement of ARVs, of reagents, should be specifically coming from our government. And the government should start domestic financing so that they're taking care of their own people. You know, when you invest heavily in security, and the security you think about is only buying guns, and health is security. When your people are healthy, you are secure. So they should look at health the way they look at security.
Kenya is facing a silent storm, and it's hitting our young people the hardest. New HIV infections are rising, adolescents are increasingly vulnerable, and young women continue to carry the heaviest burden in a crisis that shows no signs of slowing down.
We as still HIV, we have a very big problem with the child, especially on one laboratory test. And we are requesting him to liaise with NASCO so that we have a minimum package where HIV is also included, so that people who go to facilities do not fail to get the right services. Because as we stand now, the emerging thing that is killing people with HIV is NCDs. You get people are virally suppressed, but still you are losing people because of NCDs.
On this World AIDS Day, the numbers demand our attention. First, the reality check. 1.35 million Kenyans are living with HIV. 60%, which equates to 800,009, are aged between 30 to 54 years. Women account for 65%, which is 867,530 of all people living with HIV in Kenya.
Today, in this day and time, treatment is there. You don't have to die for AIDS. As you pray for help and you pray for God to touch you, just know that if you approach the Ministry of Health, the hospitals, all these stakeholders who have been announced here, you don't have to die from HIV. Doctors, you tell us now today that there is one tablet. It is not a host of those many tablets that we had before. I hear there is now one tablet, and I believe we should have that education about HIV. And 2 days ago, as I wind up, I was doing my normal medical test for the ear, and the doctor asked me, do you want to do a HIV test? So 3 days ago, I subjected myself to the testing for HIV status. So why don't you test so that you can be careful and you can take care of your neighbor?
That means nearly 2 out of every 3 people living with HIV in Kenya are women. A gendered crisis shaped by inequality, vulnerability, and limited access to services.
You find that for women, we are getting menopause quite early. For those ones are living with HIV. There's also another component of aging systematically. Unaona uso inabadilika, mwili inabadilika, body shape is different. Kama hii tumbo yangu nafikiri nataka kuzaa kesho na hakuna mtoto ndani. So there are all those things that we are getting that you don't want. You even have a hump here, the fat distribution, fat is redistributing in your body. So all those things are causing quite a problem for people who are aging.
But the most alarming trend lies with Kenya's young people. New HIV infections in 2024 indicated that 32%, which is 6,362 of all new infections, occur among adolescents and youth aged between 10 and 24. 8 out of 10 new HIV infections among young people affect adolescent girls and young women. 41% of all adult new infections occur among those 15 to 24 years.
The data that we have had from 16,000, I think 3 years or so ago, to 19,000 young, almost 20,000 cases. It was 19,900 and something. New cases of the young perishing because of the resurgence of AIDS is something for us to worry about and to reflect.
To put this simply, almost half of new adult infections are happening before young people even reach the age of 25. New HIV infections increased by 19% from 16,752 in 2023 to 19,991 in 2024. Infections among adolescents aged 10 to 19 jumped by 34%, the steepest rise among any age group.
Vijana, mulisikia the three threats. Na hiyo yote, the three threats, they're all around the young people. See, people your age. Hapo ndio iko shida Kenya. Ni kama wazee wameogopa. Everybody else is scared, but something needs to be done about your team. Please, I think there's a need for a change of behavior and attitude by our young people. Raha ya siku moja isiweke shida. And if you must do something, please protect yourself. Wasichana, msidanganywe ati ndio kama hajakuja na hiyo kitu a few hours won't do any harm at all.
28 counties recorded an increase. Only 12 counties achieved reductions by 15%.
You know, in Africa, and Kenya being in Africa, sex is not discussed openly because there are issues that culture holds back when it comes to sex education. Maybe a time has come for the Ministry of Education, the Ministry of Health, NSDCC, Parliament, Legislature, all actors, executive, to come together with the parents and the teachers, to discuss what should we have as sex education, so that if we have to eliminate this threat by 2030, we must do things in a way that we have not done them before. Even if that sex education will have to be approved by the church. Because what has happened now, PCS, is that the social media has preceded the parents in guidance on matters sex. The social media is the one that is now teaching the parents and giving the first lesson on who is a boy and who is a girl. Time has come for us to come round the table. Even if it means it's Bishop Muheria who will do that program. Let's have an acceptable program for sex education so that from a young age, we are able to tell our children who they are, to affirm their identity and to avoid the confusion of what we are seeing in identity, in gender identity, sex identity, and even in identity as personalities.
10 counties alone now account for 60% of all new infections, a concentrated crisis demanding targeted action. Now, Kenya has made progress in preventing mother-to-child transmission, but the gains are fragile.
For girls, the thing is the negotiation power, the power balance. Huyu msendi amekusimamia rent, vitu kama hizo, na bringaje ishu za condom hapo, hizo ni maujinga. Yeah, those ones need to be trained. But you find that hata wale wa mama wakubwa, ku-negotiate condom tu ni issue kubwa. So the most important thing is to find something that a woman can use that she does not need to ask a man for permission. Like the Activism ring, where you just insert, umejipanga nayo umeinsert, ama dawa zile unameza mwenyewe binafsi.
Mother-to-child transmission rose to 9.3% in 2024. The rise is driven by missed antenatal visits, poor ART adherence, and treatment interruptions. 6 counties, namely Wajir, Mandera, Isiolo, Samburu, Garissa, and Baringo, recorded mother-to-child transmission rates above 20%. These are preventable infections, yet gaps in antenatal care and follow-up continue to put infants at risk.
But more importantly for me is to put all of that context together as we design our new HIV responses to make sure it works for the person who does not know anyone, who is not in this room, who will not watch TV today, who can't tweet, who does not even know Irene because today they were so busy going to look for food, and to make sure that our government responses are felt by the people. And so that's the assurance we want to give you that this is what we are doing in the State Department for Medical Services.
On treatment, Kenya has made strides, but the gaps are still deadly. 83% of people on ART are virally suppressed. Children and men still have low treatment coverage. 13 out of every 100 Kenyans living with HIV are not on ART.
Key issue that we are getting in the report about children is parental neglect, and we are receiving cases of about 70% of all cases reported about children are issues of parental neglect. The second is about children in conflict with the law. We are getting over 70% of cases of young children between 12 years and 17 years being in conflict with the law, and one major reason is that these children are being charged for defilement. And so when I look at new cases of HIV infection among the young people from 14 years to about 24, then it correlates with what we are getting at the State Department of Children. The reason is that our children are interacting with each other. We have children getting children. So we have boy, girl ending up having children. And Chief Guest, this is the main reason why we are having these high cases of HIV infection.
21,007 AIDS-related deaths are recorded in 2024, a 3% increase from 2023. Men, who make up just 35% of people living with HIV, account for 47% of AIDS-related deaths, a sign of late testing, late treatment, and poor health-seeking behaviors. For adolescents, HIV is just one piece of a much larger crisis. The triple threats, which include rising new HIV infections, increased adolescent pregnancies, high levels of sexual and gender-based violence.
And the population that is supposed to grow up economically active, they're supposed to be educated to take over the leadership and development of this country. That is why, about 4 or 5 years ago, Your Excellency, we came together in a whole of society, whole of government approach. Both the Ministry of Health, us as NSDCC, with my brother here, Dr. Mula from NASCOP. We talked to National Council for Population and Development because they are charged with the responsibility of ending adolescent pregnancies. With the State Department for Gender, which is represented here, they are charged with the responsibility of ending GBV and including SGBV. We came together and called upon partners. We called upon ministries and line development and implementing partners and other stakeholders and actors. And we coined the term the triple threat that is challenging the health and well-being of our young people. The triple threat of new HIV infections, mistimed pregnancies, and sexual and gender-based violence. That is why we have this acronym today, and the triple threat. And that is the reason why we have focused and paid attention to this in this year's commemoration, so that we can have a future of our country and we can assure these young people whom the Constitution has demanded of us to protect.
And while prevention is improving in some areas, the surge in sexual gender-based violence shows that Kenya's young people, especially girls, are still unprotected.
The President's statement, and if I listened to myself reading it, I think he put a lot of emphasis on the teenage pregnancies. Again, I think several paragraphs are dedicated to that. Basically, he's saying what Madam Pierce was saying and what you have all said, that no children with children. I think that is his solid message. No children with children.
And yesterday, all of this culminated in a powerful moment at Nyayo Stadium, the World AIDS Day Half Marathon. Kenyans from all walks of life came together to run, cheer, learn, and stand in solidarity.
So when they are struggling with adherence, these commodities should not be lacking. They should be available so that they come, they get their commodity and go back.
And as a health communicator, being part of that marathon wasn't just symbolic. It was a reminder that behind every statistic is a story, behind every challenge is a community, and behind every step we take is the possibility of change. On this World AIDS Day, one message rings clear. Kenya cannot end AIDS without protecting its young people. We cannot end AIDS without addressing inequality, and we cannot end AIDS without running this race together. Until next time, my name is Robbie Omondi.